Hello, and welcome to Hello Health's eRX Labs and Orders training. As with all tutorials, the names and data used in this video are purely fictitious and used for training purposes only. I have logged into Hello Health using a physician's account and have accessed the Labs tab. Ordering labs can be done from a number of locations from within Hello Health. When you have a live lab integrated within your account, you have a Labs dashboard at the top of your screen. This is where all lab notifications for all of your patients are highlighted as they are received. Choosing Pending displays the requisitions of pending results. Results displays the requisitions with results that have been received, and Archived displays all results that have been archived. You will also have the ability to search for a particular patient by typing in a few letters of their first or last name in the search box, and selecting the patient whose labs you would like to review. You will note that there are various columns of information on the screen, starting from the left-hand side. There is a requisitions number column. The number here is the internal requisition ID number. Underneath this, you will see the name or names of the tests that have been ordered. Let's bring your attention to the requisitions with the blue vertical line on the far left-hand side of the information contained in this section. These requisitions are the unread requisitions with results to be reviewed. If you see a red octagon next to the requisition number, this will alert you to an abnormal test result. This icon will allow you to quickly scan through your lab requisitions in order to address the labs containing abnormal results immediately. Next, I would like to draw your attention to the patient name. In the column, you will see the name of the patient who you ordered the lab for. When the results are returned, we match the patient based on the following criteria: first name, last name, and date of birth. In the event that is unable to match any patient in your system, you will see a blue square with a lowercase I in the middle of the box on the left-hand side of the patient's name. In order to match the patient, simply click in the white space next to the patient's name. Once you click in the white space, you will see a Match Patient box appear, and you can then search in your patient panel in order to match your patient's lab requisition to the correct patient file. Next, we will take a look at the facility column. This is the lab company that was selected in the original requisition. Status is where you will see if the requisition has pending results or final results to be reviewed. The last update column shows the date the lab was last updated. The pencil icon to the far right of the screen will allow you to action a variety of tasks. You can link the result to a visit you have already had with the patient within Hello Health. If the specimen was collected in your office, you can choose to view the label PDF. From there, you can also choose to view the requisition PDF if the requisition was ordered from within Hello Health. For a final lab result, you can choose to press the pencil icon and view the PDF version of the lab result. To submit a new lab requisition from this screen, you will need to click on the New button located in the top right-hand side of the screen. Once you click on this button, you are immediately taken to a new requisition form. Starting on the left-hand side of the new requisition form, you will note that the buttons located in this section of the requisition will allow you to choose your practice location, the lab company you would like to use, as well as the facility. You can also choose the billing type. There are 3 different billing options available to you: client billing, where the practice will receive the bill for the tests ordered; patient billing, where the patient receives the bill from the lab company; and third-party billing, which we'll be using in our demonstration. This is where the insurance company for the patient will receive the bill for tests. The 2 mandatory fields required are the emergency phone number for the practice and the provider's MPI number. You will note that when you are ordering a lab from the Labs tab, none of the patient information is populated. Just type a few letters of the patient's first and last name in order to pull up their patient information card. I'd like to bring your attention back to the left-hand side of the screen regarding the patient insurance information. If your patient has insurance on file, you will find that populated here. Also, if they have a credit card on file or guarantor, you will be able to view that as well. You have the ability to add or edit this. Just move your mouse to the right side and click on Edit to edit this information. Just below, you will see the insurance company the patient currently has a policy with. From there, you can edit the insurance company, and you can also add a new one. Just below this, you will notice that there is a lab insurance match section. From here, you can edit the information by clicking on the pencil just to the right of the lab insurance match. A new window appears called the Lab Payer Matching Insurer. The lab company requires that you find an equivalent match to the current patient insurance. The list that is provided here is supplied by the lab company. If you cannot find the appropriate insurance, choose the closest match or contact the lab company. Next, we are going to move on to the Diagnosis and Tests section. You can click on Show Frequently Used Diagnosis, and this will populate a list of all the frequently used diagnosis codes, and not just the diagnosis for this particular patient. You can also search for the diagnosis by name or ICD-9 number. Once you have selected the diagnosis code you would like to add, you can either press Add, located within the diagnosis field just to the right, or you can drag and drop the diagnosis to the order summary on the right-hand side of the page. Underneath the diagnosis field, there is an order code section. This is where you can search and select the test that you would like to order. Similarly, like in the diagnosis section, you can press Show Frequently Used in order to view a list of the most frequented order codes. You can also choose to search the codes by the order code number or by the name of the test that you would like to order. Once you've added your diagnosis and order codes to the order summary, there are just a few more steps necessary before we can go ahead and submit the order. If your facility is not set up to draw samples, you will be required to click the box for specimen not collected. Your patient will then need to take their lab requisition form to a draw station for collection. However, if your practice is set up to draw samples, you will be prompted to add additional information with respect to the collection date and duration. If the lab company you have selected for your requisition is LabCorp, you will not be required to provide any additional information, such as the height and weight of the patient or if they have been fasting. If these questions are pertinent to the test that you are ordering, an additional question screen will pop up and you'll be required to answer these questions before you can order your test. This way, you will only be required to enter the information that is relevant to the test that you are ordering. However, if you're not ordering a test with LabCorp, you will be required to enter in the information into the Additional Information section. Lastly, before we submit our order, we will review the Notes section on the screen. The clinical information is where you enter any information to the testing facility or draw station regarding your patient. The information you enter in the section will not show on the lab result PDF you will receive and potentially share with your patient. A great example of this is if you have a patient who is afraid of needles. You can document the information here and it will not be seen on the result you'll receive after the testing has been completed. However, the information you enter in the report comments section could potentially be seen by the patient if you choose to share the lab result with them. Next, we will submit our lab order. Once you send the lab order, this cannot be undone. If you would like to cancel the lab order, you will need to contact the facility directly. Now let's take a look at what happens when you receive a final result. In order to view the lab, you can either press anywhere on the requisition line to open it, or you can go to the pencil icon located to the right of the screen and select View Result PDF. Once the result has been opened, you will note that on the left-hand side of the screen, there is a summary of the requisition, which contains the status of the result, requisition number, ordering provider, submission date, last update, and a session number. Just to the right, you'll see a glimpse of the demographic information with respect to your patient. I would like to bring your attention to the far right-hand side of the screen. You will note from here you can share a lab result with your patient. Once you share this result, if the patient is subscribed to a Portal Connect membership, they will have the ability to review this lab result. You can also mark the lab as reviewed. Once this has been completed, it cannot be undone unless a new or updated lab results are received. Mark as reviewed and archived. Just as I mentioned, you can mark the lab result as reviewed and archive it. This action, just like marked as reviewed, cannot be undone. Once you click on View PDF Results, the built-in document viewer will open, displaying the PDF lab result. From here, should you wish to do so, you can create a task for the lab. While in the document viewer, if you would like to view the information regarding your patient, you can simply click on Show File Info, and you will note that you have a small patient card appear at the bottom right-hand side. From here, you can action a variety of tasks and even view the patient's EHR. When there are multiple results to be reviewed, you will see PDF number 1 and PDF number 2. When there are multiple PDFs, one of those PDFs is a comprehensive patient result report, and the other is a standard Hello Health generated report. Send PDF results to patients. Once you select this button, a message box appears, and you can then write a title and a message to be sent to the patient. Turning your attention to the lab result, the lab result date is noted on the left-hand side and the status is on the right-hand side. It will show final if all results have been received, or preliminary if you're still waiting for any results to be returned. In the results section, you can review the analysis of the different tests you've ordered. They are categorized by analyte, result value, reference range, performing site, and abnormal value. If there are any tests that have returned with abnormal results, they will appear in the list with a red octagon with a white letter A inside, to the left of the analyte. Just below the test results, you will find the information regarding the performing sites. Below this, there is a note section followed by a remark section. The remark section is a free text field which can be populated by templates. Underneath these remarks, you can choose to share the remark with the patient by checking off the box. You can also sign the remark by clicking the Sign this remark box. When you sign the remark, it will be permanent and impossible to edit. In order to return to the Lab Requisition page, click on Back to Requisition button. The first type of order that I will demonstrate for you today is a radiology order, which could be part of a patient's care plan. First, click the Order button, then the Radiology toggle button. You will notice that the procedure codes are available to you in a drop-down menu, where you will also have access to your frequently used procedures. Or, if you choose, you can simply enter in free text within this field. You can add the reason for the order, a due date, and add attachments. Note also that you can use the status toggle buttons to help you follow up on your patient orders. For instance, let's say that after sending your patient for an X-ray, you receive results. A medical assistant could attach the results to the order and change the status to be reviewed for you. Notice the badge number on the Orders tab. This indicates how many orders are currently available to be reviewed. Once you have reviewed the results, you can change the status to Completed. Orders can also be created directly from the visit documentation. The second type of order that I will demonstrate is the creation of a referral. This type of order can be used when you are trying to refer your patient to a provider or unit of care. To create a referral order, select the Referral toggle button. Note that even though the reason field is not mandatory, information you type in this field will be included in the summary care record in the Reason for Referral section. Make sure to document the reason before you attach the summary care record, or else this information will not be included in the export. This field also supports custom templates for commonly placed orders. For referrals, you will notice that the recipient is a required field. You can either type free text or use the built-in Rolodex system for the providers you most frequently contact regarding patient referrals. If your referral provider has a direct address, you can securely send the referral order and patient summary care electronically to them. In order to send summary of care to other providers, you must yourself have a Hello Health Direct account. If you don't have your direct account with Hello Health, you may contact the support team if you would like to use this feature. When selecting Summary Care Record or Clinical Summary, these documents will automatically be exported and attached to your order. Please note that if changes are made to the order or the patient's EHR after attaching the summary of care record or clinical summary, you will need to reattach the documents since the attachment will not automatically update. Although the default filters in the orders dashboard is set to hide completed and canceled orders, this can be adjusted if necessary. If the status of an order needs to be changed, this can be done by clicking the pencil icon to the right of the order. When an order has been created in a visit, it is linked to that visit, and you can click on the ordered on date to access the actual visit. You can also see the related visit in the Edit Order dialog. When editing an order that is linked to an unfinished visit, any changes made will be reflected in the visit documentation. Once a visit is finished, however, you can still edit the orders via the orders dashboard. But the changes you make will not be applied to the finished visit documentation. You can cancel orders, but note that for referral orders that were sent to a direct recipient, canceling only changes the status within Hello Health and is not communicated to the recipient. We will now move on to the export and import feature. When exporting, you can now specify which section of the health record or the visit documentation you wish to export. When exporting the summary of care or a clinical summary, if the purpose is set to referral, then an order would automatically be created in the orders dashboard. Note that the export audit section reflects documents exported, both from this page and those exported automatically when attaching a clinical document to a referral. Exporting the clinical summary allows the export of all visit documentation sections. You can also export the clinical summary in PDF format. Now we will look at our e-prescribing feature. E-prescribing, or eRX, allows you to electronically prescribe medications through SureScript participating pharmacies. Creating an eRX can be done while in a visit or when outside of a visit by clicking on the eRX tab at the top of the screen, searching for the appropriate patient to select, and then clicking on the Create eRX button. First, we will look at actually creating a prescription. To do this, locate the eRX tab at the top of the screen. Now, type in the patient's name here in the search box and then select Create eRX. This will open up a medication selector. From here, you can either select a medication from the medications list, or you can choose to type your medication in the Search for Medication box and proceed to select a common dose and strand form. Once the medication is selected, we can now continue with creating the prescription. I'd like to direct your attention to the top of the right of the box where you will see the words View Monograph. If we click on it, it will bring up detailed information about the medication we have just chosen. Below View Monograph, we will see we have View Coverage. This gives us the ability to request specific information from payers and pharmacy benefit managers regarding the patient's eligibility for certain medications and whether the medication would be covered under the formulary. Taking a look under Prescription section, we have View Interactions. Clicking on this link will give us any drug-to-drug interactions or drug-to-allergy interactions regarding the medication. Now, let's complete the rest of the eRX form. You can leave Allow Substitutions checked off if you would like the pharmacy to use a generic version of the medication. The route will be filled in to oral, but can be changed by selecting the drop-down arrow and choosing the route that works best for this particular medication. Adding the SIGs will automatically populate in the patient instruction, but you can also use the patient instruction box as a free text field. Duration in days, refills, and quantity should also be filled in. The next field will indicate what form we are prescribing this medication in, whether it be tablet, capsule, etc. The start date will always default to today's date, but can be changed to reflect past medications as well as future medications. The note box is here if you would like to communicate anything to the pharmacy. Now, click on the RX button. The box shown will give us a summary of the information we have already entered: patient, provider, prescription, and pharmacy. Patients can actually have their favorite pharmacy saved for future use. If a patient does not have a pharmacy linked to their account, simply click and choose on Pharmacy and find a pharmacy in the area. Now we are ready to send the eRX or save the prescription to the patient's EHR. Let's take a step back now and look at the eRX overview page. We will see that we can filter our eRX results by prescription sent, refill, or error, as well as by the status, all, pending, or processed, and finally by the start date. At the actual results, we will see that we have the patient's name, medication, status, type, pharmacy, and date. For some of the patients, just as with lab results, we may have to match their name before we can process the refill request. Any patients with not matched yet will need to be selected by clicking in the white of the result box next to their name. Once the patient match box is opened, we will see that we have the patient's name and date of birth. We will need to match this info with a patient in our practice by typing in the name in the search box. Once the correct patient is found, click in the box to match the patient. Should the patient not be found, we can also choose the Patient Not Under Care box, and then continue to deny the refill request to the pharmacy. This now completes the training.